Let's talk about whether or not you should exercise when you're sick. I guess maybe about a month ago, a few weeks ago, I was really sick. And if you've watched these videos for any period of time, you know I love to lift weights. But I was pretty sick and really didn't feel good, but I love to lift weights. And so I was really trying to figure out, should I go? Feel terrible, may benefit from just, laying on the couch or taking it easy, or do I kind of push through it? And I'll tell you what I did. I did try to get through it. Afterwards, kind of wished I hadn't. So let's decide if this is a good thing to do or not. Should we push through our training, our exercise, when we have an illness that's really making it difficult to do it? I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist. I provide education and insight on sports and exercise injuries, injury treatments, and injury prevention for athletes and active people so that you can stay healthy and perform your best. We love to exercise. We all do, hopefully. And so it's not uncommon, you get, allergies, you get a GI bug, all sorts of different things, and you don't know if you should try to push through exercise or not. First thing I'd say is, one day off is not going to kill you. We'll talk about should you and what potentially you should do. But one of the things to consider is a day off is not the worst thing in the world. We're not talking about taking a month off or a week off. It's not going to set you back that much. So just keep that in mind, that one day off might do your body a world of good. Now, I think it is worthwhile to decide if it's safe to do exercise or not while you're sick. If you have a fever and the fever's above roughly about 101 degrees, we generally recommend, especially the medical doctors recommend, hey, maybe you hold off, you don't exercise that day. Some of it's based on symptoms though. The rule of thumb, especially with upper respiratory symptoms, sneezing, coughing, congestion, things like that, the rule of thumb is whether or not it's above or below the level of the neck. So if your symptoms are above the level of the neck, sinus congestion, sneezing, runny nose, it's probably okay to exercise. If they're lower than the neck, so it's congestion in the chest, cough, things like that, maybe better to hold off and not exercise. If there's any questions, definitely talk to your doctor. Now, another thing to consider, if let's say you do decide to exercise, you've got to drink a lot of fluid, especially with GI illnesses where you've been vomiting or you have diarrhea, something like that. You may already be dehydrated. Even with upper respiratory stuff, you may be dehydrated. So if you compound that with things that cause you to sweat a lot, then that potentially creates a fairly dangerous situation. Along those same lines, if you do decide to do it, cut down your intensity. That's what I did when I trained. Instead of trying to do my max reps, because I try to increase both weights and the number of reps when I go to each subsequent workout session, but I cut mine down because I knew I wasn't feeling that good. I got in the gym and did the exercises I wanted to do, but I dropped the weights, dropped the intensity, dropped the reps, and that's what I would tell you to do so that you don't get hurt. The last thing is, I can't do a video on whether or not you get sick, whether or not you exercise, without recommending it be in your best interest to try to prevent getting sick in the first place. So eat a well-balanced diet with fruits and vegetables. Maybe you take antioxidants. Maybe you get regular exercise. You normally drink a lot of water. You do things to keep your sleep in check. You sleep well. You even, like we said, exercise regularly, use hand sanitizers, whatever you have to do to keep your body healthy on a regular basis so that you boost your immune system, you're not susceptible to these viruses and the bacteria, and you stay out of the doctor's office and stay in the gym or out on the roads. Just a thought you might want to try to prevent getting sick in the first place. Have you been sick recently, and were you able to keep training? What did you do differently? Did you go see the doctor? I'd love to hear your thoughts, so below this video, share your thoughts so that people all around the world can learn from your experience. If you like videos like this and you want more information on sports and exercise, injuries, injury treatments, and injury prevention, subscribe to my YouTube channel. I record a couple of these videos every single week, and I'll deliver those directly to you. Thank you so much for watching. I hope this was helpful. If you know somebody that's sick and is trying to exercise, maybe you could share this video with them so it can help them decide what to do. I look forward to seeing you right here next time.